Now we'll go to our final witness on this panel, David Watson from San Francisco. Mr. Watson, thank you so much for coming today.
Thank you very much. Good afternoon. Thank you to the Select Committee on Monkeypox. I appreciate the opportunity to testify today about my experience with monkeypox. I first want to say that this monkeypox epidemic was predictable and preventable at a federal, state, and city level. As of this hearing, it is my 29th day since the onset of the illness. My family suffering could have been avoided had the government and the associated agencies acted in an efficient, timely manner to meet their responsibilities to the people of the United States. Secondly, I was exposed to monkeypox through casual contact, not intimate contact. My first request for the vaccine was early June, when word of the spread in other countries was on a sharp rise. I was told that it was being worked on, but there was none available, and it was up to the federal government to release it. I inquired again at the end of June, and then again on July 7th, after having a nasty bout of COVID, I received the same response. Unbeknownst to me, the next day I was exposed to monkeypox through casual contact. I ran into a friend on the street. We proceeded to hug and kiss on the cheek. My friend had a single lesion on his cheek, which he had mistaken for an ingrown hair, resembling a reddish pimple. On July 12th, 5 days later, I developed a cough, which progressed into flu-like symptoms the following day. The onset of lesions didn't start for 4.5 days after my initial symptoms, which is 3 days longer than the CDC given timeline. It started as a single pimple on my cheek, which I still have a scar from, healing wound from. My sickness, as it progressed, the lesion moved from my face to my hands and then to my rectum. I ended up in the ER 3 times over the course of 4.5 days with excruciating pain that opioids could barely touch. It took 2 doses of morphine my first time in the hospital to knock down the pain to a manageable level. It didn't matter whether I was sitting, standing, or lying down, the pain was off the charts. I had to be tested for monkeypox twice, as the first test came back negative. Testing took 3 full days to come back, and further extending my suffering. It was a total of 7 days to get a positive result. Access to TPOXX antiretroviral treatment was also a harrowing experience, to say the least. I didn't qualify at first because I didn't meet all the CDC criteria. Fortunately, the CDC softened the guidelines in the 2nd week of my sickness. That said, it took 12 days of unimaginable pain before I received TPOXX. Within 24 hours of my first TPOXX treatment, my pain had been reduced in half. And within 48 hours, it was reduced by 2/3. As soon as we suspected I had monkeypox, we tirelessly tried to get my husband vaccinated without success. My husband developed his first lesions 1 week after my initial symptoms and only had a very mild fever as a symptom. He had none of the other symptoms that I had had. 2 days later, one of our dogs got her first lesion, and the other showed lesions 5 days later. And while we're on the men, I also have to contend with several lesions becoming infected with a bacterial infection as a result of monkeypox. And this has further prolonged my sickness. In addition to the physical ailments, my family is concerned about the financial impact of having this illness. I'm currently unemployed, and we rely 100% on my husband's income to live on. He has already used up all of his sick time and will likely be forced to go on short-term disability to cover the additional time off. With that, he'll only receive 60% of his normal pay. We barely make ends meet now, and at 60% of pay, we have no means of meeting our basic financial needs. I've been forced to take job interviews while coping with this illness, and all the while being on fairly high doses of opiates. Additionally, if extra care is necessary for our 2 dogs who are taking longer to heal, we have no means to pay for it. I'm not here to only relay what we went through on a personal level, but I'm also here to ask for your help to move the needle forward. We demand accountability for the national vaccine stockpile being allowed to expire. Why were those doses not sent to Nigeria before the expiration to help them and possibly stop the now global spread? Why the 300,000 doses sat in Denmark for months waiting for on-site approval by our government, especially when other countries approved that site last year? Part of the increase in my community is the fact that monkeypox hit at the beginning of Pride Month. That had vaccines been available at the beginning of the month, by the time the two largest Pride events happened, which is New York and San Francisco, my community would have been less impacted. And that has to be taken into account and has not been spoken of as to partially why my community has also been so vastly impacted. It was the timing in which it happened. We need better education on transmission that doesn't stigmatize the gay bi community. This can be transmitted through both casual and intimate contact. Anybody who's infected can pass it on to anybody else. We need more rapid testing with acceptable turnaround times. 3 days to get a test result is not acceptable. Not when you're in the amount of pain that I was in. This includes new forms of early detection testing that don't rely on swabbing lesions, because at that point, it's already too late. The likelihood of already passing it along is much greater. We need more doses of the vaccine, and we need them now. There needs to be more than one manufacturer of the vaccine. This is a vaccine owned by this country. We put $1.8 billion into this vaccine, its creation. Why is only one company making it for us? It's ridiculous. Monkeypox antiretroviral needs emergency authorization so a doctor can just write a prescription, that you don't have to go through a 57-page document in order for doctors to do that, and then patients have to go on and sign a digital release for the medication. We need better access to all forms of treatment, and we need equal access for all. We need to stop the suffering now. Lastly, I'm not here for your sympathy. I'm here for fast and meaningful change. Thank you, Senator Scott Wiener and your staff for the opportunity to speak here today, and I appreciate your time. Thank you.
Thank you very much, Mr. Watson, and thank you for sharing. So, colleagues, any questions for the witnesses on this panel? Not? Senator Allen.
I just want to take a quick moment to just thank everybody for their testimony. I mean, so it really does drive home how at risk everybody is, and how much our system has failed, and how much we need to both inform ourselves as policymakers, push those responsible and those able to help to address the systemic issues that were just raised by the last witness. And I just it's very compelling testimony, and I appreciate people's willingness to share such personal information to help make this policymaking response stronger.